Thank you. The final item of business this evening is a members' business debate on motion 19950 in the name of Bill Kidd on the mental health impact of cell therapies. The debate will be concluded without any questions being put. And I would invite those members who would wish to speak in the debate to please press the request to speak buttons. And I call on Bill Kidd to open the debate. Up to 7 minutes, please.
Thank you very much, Presiding Officer. And I'd like to begin by thanking parliamentary colleagues from across the Chamber for the overwhelming support signing up for this motion. Cell therapies, including stem cell transplantation and CAR-T therapy, represent one of the most significant breakthroughs in modern medicine. Stem cell transplantation involves replacing damaged or diseased bone marrow with healthy stem cells, often following intensive chemotherapy or radiotherapy. CAR-T therapy, meanwhile, involves collecting a patient's immune cells, re-engineering them in a laboratory to recognise and attack cancer cells, and then re-infusing them into the patient. These treatments are often complex, lengthy and physically demanding. They can involve prolonged hospital stays, isolations from loved ones and a lengthy recovery period that extends far beyond discharge from hospital. And while they offer hope and, in many cases, a cure, they can also bring immense psychological strain for patients and their families. I'd like to thank the charity Anthony Nolan Trust and all of its staff and volunteers for their invaluable work supporting patients, families and donors. Founded in 1974 by Shirley Nolan to find a stem cell donor for her son Anthony, the organisation has grown into a world-leading charity that has transformed transplant services and donor registries. For decades, it has been at the forefront of research, patient advocacy and clinical support, and Scotland's transplant community owes a great deal to its dedication. Its June 2025 report, How We Can Improve the Mental Health and Wellbeing of Cell Therapy Patients, presents compelling evidence that mental health must be treated as an integral part of the overall care experience. The report highlights that almost half of all patients experience anxiety prior to transplant, over a third experience depression during treatment, and a fifth develop post-traumatic stress disorder. These figures remind us that survival alone cannot be the only measure of success. This emotional toll extends well beyond the patient to families, carers and others who often face exhaustion, anxiety and significant financial pressures, with families losing on average around £30,000 in income during treatment and recovery. One patient described how mental health support, particularly during and following the treatment, would be a very welcome addition to patient care. The ongoing risk of return affects mental health and family relationships going forward. Another added that mental health is sadly overlooked. Patients aren't given the support urgently required when given a blood cancer diagnosis, and these voices must guide our responses. The evidence clearly shows that mental health support remains inconsistent across Scotland. Currently, only NHS Greater Glasgow and Clyde has access to a specialist bone marrow transplant psychologist, despite transplant centres also operating in Aberdeen, Dundee and Edinburgh. As new CAR-T centres open and patient numbers increase, specialist psychological provision hasn't unfortunately expanded at the same pace. In several NHS boards, there is no specialist oncology psychology support at all yet, meaning that patients leaving hospital are often left to navigate general mental health services that they may not fully understand of their complex clinical experience. Certain groups are particularly vulnerable. Patients undergoing treatment for non-malignant conditions such as sickle cell disease and thalassemia frequently fall outside of oncology pathways despite facing identical treatment burdens. Families, carers and siblings who often experience their own trauma and distress rarely receive structured psychological support. The recommendations set out by Anthony Nolan Trust are both practical and achievable. They call for every cell therapy patient to have access to a specialist transplant psychologist throughout their treatment journey. They emphasise the importance of training all patient-facing staff so that mental well-being is recognised and supported at every stage of care. And crucially, they highlight the need to extend psychological support to families and siblings, recognising that serious illness affects entire households and not only individuals. It is, however, important to acknowledge the progress that is already being made in Scotland. The Mental Health Strategy 2017-2027 sets out an ambitious national framework, and the Scottish Cancer Strategy recognises that psychological care must be a fundamental part of cancer treatment. These strategies are very welcome and I believe demonstrate the Scottish Government's commitment to holistic healthcare. I also welcome the continuing engagement and support of the Cabinet Secretary and Ministers who have shown genuine interest in addressing the mental health challenges associated with advanced therapies. I'd also like to thank, alongside Anthony Nolan, for the work they do, organisations such as NHS Macmillan Psychological Support Project for their valuable mapping work, Blood Cancer UK and Myeloma UK for their innovative support projects such as Myeloma UK's Peer Buddy service, which matches people up with trained peer buddies for one-to-one support from someone who has experience of HDT-SCT, and their myeloma support groups, which provide the opportunity to meet other patients, carers and family members to share experiences and information in an informal and supportive setting. I'm encouraged by these and other initiatives and the collaborative approach that is emerging across the sector. On that particular note, I'm very pleased to be hosting a round table alongside Anthony Nolan Trust next Thursday lunchtime, that's the 12th of February, on the issues we are discussing today, bringing together the Scottish Government, clinicians, charities and patient representatives. This meeting will represent an important opportunity to build consensus and accelerate progress, and I hope many members will consider joining us on the day. Presiding Officer, Scotland has rightly earned a reputation for excellence in clinical innovation and compassionate healthcare. As cell therapies continue to evolve and save more lives, we must ensure that mental health care evolves alongside them. Patients who undergo these treatments demonstrate extraordinary courage and resilience. They and their families deserve the support that reflects the full reality of their experience. I urge all those involved in delivering cell therapies, government, NHS boards, clinicians, charities and Parliament to commit to working together to implement these recommendations, because by doing so we can ensure that every patient in Scotland receives not only cutting-edge medical treatment but the psychological support and dignity that they deserve. Thank you.
Thank you, Mr Kidd. We now move to the open debate. Backbench speeches of up to 4 minutes. I call Fulton McGregor to be followed by Sanjay Gohani. Mr McGregor.
Thank you, Presiding Officer. I'm pleased to speak today about the mental health and wellbeing of people in Scotland who undergo cell therapies, including stem cell transplants and CART treatment. And I would like to put on record my thanks to Bill Kidd for bringing this issue to the Chamber. And I note, as he has done, the significant cross-party support that the motion received. The cell therapies referred to in the motion represent some of the most advanced care delivered anywhere in the world. For people living in Scotland living with blood cancers and rare blood disorders, they can offer life-saving treatment and renewed hope, where specialist centres, clinicians, researchers and nursing staff provide this care with expertise and dedication, often under significant pressure. Their contribution to Scotland's health service is considerable. Yet alongside these medical advances, there is an essential part of care that requires greater focus: the psychological experience of patients and their families throughout the cell therapy pathway, and Bill Kidd has outlined that very well. The Anthony Nolan report provides clear evidence of the emotional impact of these treatments and offers insights that are directly relevant to Scotland. Cell therapy can involve lengthy hospital stays, intensive treatment regimes and extended periods of isolation. For many patients, this means time spent far from home, particularly for those living in rural and island communities who must travel to specialist centres. Separation from family, disruption to work and caring responsibilities and uncertainty about outcomes place a significant emotional burden on patients. Many people experience anxiety, low mood and trauma-related symptoms during treatment and recovery. Adjusting to life after treatment can bring further challenges, including ongoing health concerns and changes to identity and independence. These experiences shape recovery and quality of life long after hospital discharge. Families, carers and donors are deeply affected as well. Partners may take on caring roles while balancing employment. Parents may support children through treatment far from home. Donors may carry emotional weight connected to outcomes they cannot control. Their well-being influences the patient journey and deserves recognition within our healthcare system. The report highlights variation in access to psychological support across cell therapy services. Specialist mental health input is available in some settings and limited in others, as outlined by Bill Kidd. Routine screening for psychological distress is not consistently embedded within care pathways, and this creates unequal experiences for patients across different parts of Scotland. And it is an issue I will take up directly with NHS Lanarkshire following this debate. Mental health care strengthens clinical care. Psychological support helps patients engage with complex treatments, manage uncertainty and navigate recovery. Early identification of distress allows timely intervention and contributes better to long-term well-being. The report offers practical recommendations that align well with Scotland's commitment to person-centred care. First, specialist clinical psychologists should be integrated into all transplant and cell therapy teams within NHS Scotland. Their presence supports patients throughout treatment and recovery and enhances multidisciplinary working. Secondly, staff across all disciplines should receive training to recognise and respond to psychological distress. This will build confidence, encourage compassionate conversations and support continuity of care. Thirdly, peer support should be developed and supported across Scotland. Patients consistently value opportunities to connect with others who share similar experiences. Peer support can be particularly meaningful for those returning to communities where specialist services are less visible. Fourth and finally, families and donors should have access to appropriate psychological and practical support, and this should also provide for guidance concerning end-of-life and bereavement. Scotland has made clear commitments through its mental health strategies and its approach to personalised care. Cell therapy pathways provide an opportunity to translate these commitments into action within one of the most intensive areas of modern medicine. By embedding psychological care alongside advanced treatments, NHS Scotland can improve patient experience, support families across urban, rural and island communities and promote recovery that addresses both physical and emotional well-being. This approach reflects the values of a health service that recognises the whole person and supports people through every stage of treatment and beyond. Cell therapies, presiding officer, save lives. With integrated mental health support, they can also help people across Scotland live well during treatment and in the years that follow. I encourage this Parliament and indeed the next Parliament to support the continued development of psychological care as a care component of cell therapy services in Scotland. I look forward to the Minister's response to the point raised today. And again, thank Bill Kidd for bringing this motion to the Chamber.
Thank you, Mr McGregor. I call Standish Gohani, who is joining us remotely, to be followed by Cara Mockin. Dr Gohani.
Thank you, Deputy Presiding Officer, and a declaration of interest as a practising NHS GP. As a doctor of over 20 years, I've seen how physical illness and mental health are inseparable. Across NHS Scotland, we recognise that patients undergoing major surgery, systemic chemotherapy or living with chronic and life-limiting conditions commonly experience anxiety, depression and trauma-related distress. This is well evidenced in our national clinical guidance and reflected in routine primary care practice. However, cell therapies such as stem cell transplant and CAR-T present a particularly profound mental health challenge, and one that our current systems are not yet consistently designed to meet. Cell therapy is not a single event. It is an extended, high-intensity treatment pathway. Patients often endure prolonged uncertainty before treatment, followed by aggressive conditioning, significant physical toxicity, and long periods of inpatient isolation within specialist centres. In Scotland, this frequently means travelling far from home, disrupting family life, employment, and social support networks. From a clinical perspective, cell therapies carry a unique physiological burden. Patients face high-stakes uncertainty. This treatment may offer cure, but it also carries a real risk of severe complications or mortality. Neurocognitive effects, delirium, mood disturbance, and post-treatment psychological sequelae are well recognised, both as reactions to illness and as a direct consequence of treatment-related inflammation and medication. Families, too, experience sustained emotional strain. They are often excluded from day-to-day care during prolonged admissions, yet expected to provide complex support once patients return home. As a GP, I frequently see carers in distress, struggling with anxiety, exhaustion, and a lack of clear post-treatment guidance. Crucially, the mental health impact does not end at hospital discharge. Survivorship following cell therapy can involve long-term cognitive impairment, fatigue, fear of relapse, and difficulties reintegrating into work and family life. In NHS Scotland, much of this ongoing care falls to primary care, often without formal psychological follow-up or clear shared care pathways, though this is not to suggest that only cell therapy patients need mental health support, because major illnesses and subsequent treatment in a hospital provide major trauma to people and can often significantly change patients' lives. But cell therapies are distinctive in their intensity, duration and complexity, and they therefore require a more proactive, embedded and coordinated physiological approach. Presiding Officer, recognising the mental health impact of cell therapies is not about exceptionism. It's about delivering holistic, realistic and compassionate care. If all those involved across NHS Scotland commit to working together towards these recommendations, we can ensure that patients and families in the Greater Glasgow region and indeed across the country receive not only cutting-edge treatment, but the psychological support that allows recovery to be truly meaningful. Thank you.
Thank you, Dr Gohani. And I call Karen Mochan. Ms Mochan.
Thank you, Presiding Officer. Can I, of course, start by thanking Bill Kidd for bringing this important debate to the Chamber. And I'm always pleased to join his debates, which are often ones that Parliament don't always have the time to really shine a light on, whether it's international issues focusing on peace or issues like today focusing on the care and delivery of services to our constituents. They are always such important issues that he brings to us. As others have said, it is important that we consider and describe the therapies within the motion, and Dr Gohani obviously described that very much more eloquently than I can, and the intensities of the treatments. But stem cell transplant and similar cell therapies are often the only curative options for patients with blood cancers and blood disorders. Patients can receive their own cells or cells from a donor, such as a sibling or an unrelated volunteer. And on researching this debate, it is clear that the toll on people's health must be enormous. To have cancer, we can all think and look at the physical presentation and think of how it affects us in that way. We can see physical presentation of disease. The treatment is very present when you see some of these therapies, and even the journeys back and forward for diagnosis and treatment. I think we can all imagine how that affects us physically. But I think that this important report really lays out the reasons that a patient receiving stem cell transplants and similar treatments must receive that mental health support that Bill Kidd and others mention and is mentioned in the motion. While these therapies are potentially life-saving, they are so intensive and they do have a lot of steps to go through, and ultimately they have these lifelong consequences of thinking what is happening to your body. Typically, patients have made journeys for diagnosis. Then we all know it can be very difficult to move on to that specialist service. When you've maybe built up a link with services, you then move to a specialist service before finally getting treatment. And we know this treatment is so intensive with multiple visits, often isolation to receive chemo or radiotherapy before the actual infusion. And this report has highlighted just how emotional this journey is, both for the patient and for the family. I want to really raise the voices of many of my constituents who live in very rural areas. It's often the case that that treatments such as this are raised with me, that these treatments cannot be carried out at local hospitals often, and patients and their families do accept this. They understand the importance of these specialist services. However, we must understand the additional strain that puts on that family unit. So more support might not be there as frequently or immediately because of transport or other commitments far from these centres of excellence. And I raise this as I know we really in this chamber do value the incredible specialist services and the work that they do. But as parliamentarians and representing our constituents, we must think how do we make sure that these families and these individuals get that mental health support that they really, really need. The NHS is under considerable strain of resources. We know that. Staff work incredibly hard every day to provide care and treatment in their jobs. So it's our job to really think, how do we make sure that we maximise the points that were raised in the report, and others have mentioned specific things that I'm sure the Government are working on. I really am looking forward to the response from the Minister, because I think this is something that we will all agree on is really important. And again, I just want to thank members for their contributions and, of course, Bill Kidd for bringing it to the Chamber today. Thank you, Presiding Officer.
Thank you, Ms Morgan. And I now call on Minister Tom Arthur to respond to the debate. Up to 7 minutes, please.
Thank you, Presiding Officer. And I would like to begin by thanking my colleague Bill Kidd for bringing this motion to the Chamber today, and in doing so pay tribute to Bill Kidd for his years of tireless support and advocacy and work on behalf of Anthony Nolan, which I know has been recognised. He is a tremendous ambassador for the charity, and he is an example of all of us of how to champion a cause. And I know I certainly draw inspiration from Bill's work, and I'm sure many in here in the Chamber do as well. I'd also like to thank Fulton McGregor, Sandy Shkohani and Carol Mockin for their important contributions to this debate. Cancer remains a priority for the Scottish Government, and our ambition is clear: prevent more cancers, reduce the impact of diagnosis and deliver compassionate, consistent services that improve outcomes and survival. Our cancer strategy for Scotland 2023 to 2033, supported by our initial Cancer Action Plan 2023-2026, will help us get there. Latest statistics show that the risk of dying from cancer in Scotland is at a record low. However, we know we must do more at a greater pace to improve survival and support for those affected by cancer. I recognise the significant physical and mental impacts cell therapies can have on individuals. As we have heard, the immunocompromising nature of the treatment means patients must isolate, unable to work or socialise, while managing not only the physical side effects, but also the anxiety of waiting to find out if the treatment has been successful. Advanced therapies are transforming treatment pathways, particularly for rare conditions and cancers. Their introduction requires coordinated planning across clinical services, data, logistics and workforce. CAR-T is, as we have heard, one of those advanced therapies. The treatment is personalised for individual patients, meaning their immune system is no longer compromised in the same way as traditional cell therapies, offering patients a more targeted and potentially less burdensome treatment. Such treatments for cancer are often done in tandem with other chemotherapy services. Access to these medicines is vital for patients with cancer. The Scottish Government remains firmly committed to ensuring access to medicines that the people of Scotland need. Through the Scottish Medicines Consortium, we have a robust, independent process for assessing the clinical and cost-effectiveness of new medicines, which ensures value for both patients and the NHS. We have committed to additional funding for chemotherapy services, reaching up to £10.5 million per annum by 2027, with £3 million released in 2023-24, £4.6 million released in 24-25 and £6.6 million in 25-26. The funding will support increased regional working, workforce recruitment and maximise capacity across the existing workforce through initiatives like non-medical prescribing and treatment closer to home. But of course, as we have heard, Presiding Officer, cancer care is not just about treatment. Facing an unknown journey is daunting, and people need emotional, practical and sometimes financial support. That's why we have invested in the £27 million partnership with Macmillan Cancer Support to roll out Improving the Cancer Journey nationally. As part of this programme, each patient will receive a holistic needs assessment to generate a care plan to meet the needs identified. In addition, our single point of contact pilots are improving access to care and timely reporting of results, and supporting people to navigate complex cancer pathways, placing individuals firmly at the centre of decisions and actions that affect them. The single point of contact pilots have been found to have had over 30,000 patient interactions, freeing up over 3,900 hours of clinical nurse specialist time and, crucially, improving experiences. We are actively considering how we best scale up this approach to benefit all patients with cancer in Scotland. Just as the Anthony Nolan research focused on patient-reported experience, the Scottish Government is committed to supporting the development and use of patient-reported outcome measures, PROMs, in Scotland. Capturing PROMs in routine cancer care can help monitor treatment impact on quality of life, improve discussion with patients, inform treatment decisions, and transform care pathways which impact the value and sustainability of cancer care. Further, the Scottish Government Communities Mental Health and Wellbeing Fund for Adults has provided funding to a range of initiatives, including for cancer-specific projects delivered by the Beatson Cancer Charity in Glasgow, Team Jack Foundation in West Lothian, and the Western Isles Cancer Care Initiative, as well as programmes of work that specifically focused on psychological support for people affected by cancer. The Scottish Government published the Mental Health and Wellbeing Strategy and accompanying delivery plan and workforce action plan. The strategy committed to improving mental health outcomes for all, including people with long-term physical conditions, and prioritises reducing inequalities. Since 2020, we have invested £164 million in community-based supports for adults and children. This will continue with £15 million baseline per annum going to local authorities every year and £15 million in funding for projects for adults in 26-27 as part of the Fairer Funding pilot. Both funds provide much-needed focus on early intervention and prevention, delivering tailored support to keep people mentally healthy. Finally, I would like to give my sincere thanks to those, such as Anthony Nolan, who are providing valuable information, help and support to anyone undergoing cell therapy as part of their cancer treatment. We will continue to work closely with the third sector, including Anthony Nolan, community and social care partners, to deliver the right care at the right time for the people of Scotland. Again, I would like to reiterate my sincere thanks to Bill Kidd for his tireless work in this area in bringing this important motion to the Chamber this evening.
Thank you, Minister. That concludes the debate and I close this meeting.